This is the On Humans podcast with your host, Ilari Mäkelä. Children are born selfish. In the beginning, they are egocentric. They do not understand others. They do not care about others. And this is the natural state for humanity, which you can perhaps replace with education, making people internalize norms that force them to take others into account, or at least pretend that they take others into account. Or so has been a traditional view of childhood amongst many scientifically minded thinkers. Variations of this view have been proposed by people from Sigmund Freud to Richard Dawkins. Now, details aside, the basic idea is that the beta ranges of our nature, if they are such, are largely products of maturity, perhaps social conditioning, perhaps learning, intelligence, etc., but utterly lacking in the kind of original state of the human mind. Now, this might sound very scientific, but what actual evidence do we have about children's motivations in young childhood? To discuss this topic, I have Dr. Amrisha Vaish on the show. Vaish is a developmental psychologist at the University of Virginia, and she's famous for some really landmark studies in this field, which has helped the field question many of the kind of implicit assumptions that were never really based on evidence as much as theory. It was a wonderful thing to have Vaish on the show. We discuss many things, from whether children do help others instinctively, and if they do, why would they do it? Do they want to look good in the eyes of others? Do they want praise? Or do they genuinely care about the plight of others? We also discuss matters such as if children do care about others naturally, what, if anything, should parents do to enforce this development? Should parents praise children when they do right? Should they punish children when they act selfishly or cruelly? We mention a lot of scholars and a lot of work. If you want to check any of these, there is a full list of mentioned names in the episode description in the show notes. In the show notes, you will also find a couple of book recommendations if you want to learn more. And as always, you might be eligible, and you probably are eligible, to get one of these as an audiobook for free. Just check the instructions there. Finally, I do want to remind that researching, interviewing, and editing the show takes up a lot of effort and resources. Now, if you have only just discovered the show or you only come here sporadically, then please just sit back and enjoy the episode. But if you are a regular listener and want to become more involved in supporting the show and making it more sustainable, you can now do so. The episode description will have a link to my Patreon account where you can become a monthly donor. Please do consider it. But let's leave the practicalities aside for now, as my most important wish is that you enjoy the episode. I bring to you Amrisha Vaish. Dr. Amrisha Vaish, welcome to On Humans.
Thank you so much.
According to people like Freud, morality develops when societal norms repress or replace the original selfishness of the individual. Would it be right to read your line of work as a kind of response?
I think it would, yes. I think our line of work speaks response to Freud and response to a couple of other proposals in terms of the emergence of morality. But yes, specifically with regard to Freud, there's certainly a way in which our work is countering that proposal by saying that actually there are seeds of morality present very early on. There are proclivities and tendencies that at least are the building blocks of morality that are present very early on and that don't require a repression of all of the egoistic and selfish impulses that Freud was talking about.
So it is not so much repressing everything that's natural to us and replacing it with something, but it's rather kind of cultivating some seeds rather than others, would it be right to say, to develop into a morally mature person?
Yeah, I think that's right. Exactly. So my stance, and I think the stance of a lot of people who work in this area is, or at least take my kind of approach, is that there are seeds of all kinds of behavior that are present, or all kinds of tendencies that are present from the start. And that includes pro-social and moral tendencies, but it also includes some egoistic and selfish tendencies that we're sort of born. We come into the world with both, and it would be weird to imagine that we didn't. For important reasons. And so both are constantly present, I think, and that continues into adulthood. Neither of those entirely vanishes in most of us. That both continue to coexist. And a lot of what we do in our social lives is navigate between those two spaces and those two and sort of play out those conflicts and sometimes one wins and sometimes the other wins, and sometimes in some way both win. And so a lot of development is learning to regulate between those impulses and hopefully move towards cooperative and moral impulses and further away from the more selfish impulses, but not always. Sometimes that's what's needed as well.
Well, maybe we can go through some examples, some experimental examples. So let's say you meet the ghost of Freud, and
Yeah.
and he asks you, well, give me one example, give me one good reason why I should believe that infants, young children have naturally anything else than self-concern.
Yeah. Picking one favorite is really hard. It's like picking your favorite child, I would say, but there's a lot of different examples. um, I mean, I think now the most classic kind of example is the very early cases of instrumental helping, which is helping others achieve a physical goal. So that looks like someone is, and was started. The first of this work was by Felix Warneken and Mike Tomasello, and they've published several papers on this. But now it's been shown by lots of people and sort of robustly, even across cultures, that an adult, let's say, is trying to achieve some kind of goal. They are reaching for something that's out of their reach and they're kind of extending their arm out. They're trying to reach it and they can't. And an infant, approximately somewhere between 14, 18 months, somewhere in that second year, is watching this happen. And what very often will happen is that infant, who's barely just toddling, just able to get up and move around, will actually make what looked like a pretty big effort for that infant to go towards this object that this adult is reaching for, pick it up, and then hand it over to the adult. Very, very simple action, right? It doesn't look like much necessarily, but if we break it down into the fact, first of all, that this is happening at really early ages, it does take some effort for that infant. And we break it down in terms of the motivations. Why would the infant ever do this? Why would they care? Why would any of us ever care to help anyone else if all we have are egoistic impulses? So according to Freud, as you were pointing out, it's only later that we might begin to show these kinds of behaviors, but actually the experimental evidence is very clear that it's really very early that infants, toddlers begin to show that kind of early helping. We also have evidence from even the first year that infants show looks of concern for someone who's in distress. So even by 6 or 7 months of age, which is really fairly new evidence. We used to think that that's something that emerged only in the second year, but there's evidence from Mayan Davidov and other colleagues showing that it's actually already in the first year that when infants see someone in distress, they can't move yet, they can't locomote yet, but they show in their facial expressions something that looks very much like concern, very much like the concern that we see at older ages.
Do I remember right that one of your papers referenced a study where I think maybe it was 12 months old, maybe even earlier, that infants who wouldn't really be able to pick up, for example, that pen that an adult would have thrown, would, if an adult is trying to find it, would kind of just like look with their eyes towards the direction as if trying with their gaze to
And with
help
their
the adult.
pointing, yes. If they are not
Pointing,
able to,
yeah.
with pointing, exactly. So even if they aren't able to do it, if they can see the object that the adult can't see and the adult is looking for that object, I think it was 12 months. That's right.
12
They
months, okay.
point, I think it was somewhere 12 to 14 months. They will point at the object as a way to help, right? Exactly.
And I think that's really important because it shows that even if we wouldn't find evidence for, say, helping behavior very early on, it might not be because of the concerns, sympathies, and desires of the infant as much as the fact that, well, before you can do anything, you can't really show that you want to help.
Yes, exactly.
Yeah, so I think it's methodologically just interesting to notice that it kind of, the more we look, the earlier we find some indication of the concern.
That's right. And the more sensitive our measures are, the earlier we're able to show some of these tendencies that some years ago, when we were relying entirely, let's say, on asking children verbal questions, they couldn't tell us that motivation. They couldn't tell us what they were thinking and how they were perceiving the situation and what they wanted to do. But now when we look at their actions, we can see actually a lot of these motivations and behaviors much earlier than we had originally believed.
Yeah.
And, just sort of on a tangent, there is some really nice work from Robert Habuff and myself, but others as well, showing that even young children do what's known as it's called paternalistic helping, but maybe we call it parentalistic helping in order to be uh,
Very good. Yeah.
right. Someone is reaching for something, but they know but the child knows that that thing doesn't work, and there's another one that does. So rather than giving the immediate thing that the person is reaching for, they'll actually give the thing that the person will actually help the person,
Yeah.
right? So thinking about their ultimate goal rather than their immediate proximate goal, right? And that is another really nice piece of evidence that young children um, are really thinking about what it is that you need rather than, for instance, I mean, the one of the alternative explanations for some of this helping is, oh, they see an unfulfilled goal and they just want to fulfill it. Like they see an unfulfilled reach and they just want to put something in the hand. But we have actually shown that when someone is reaching for something and some of the objects that they're reaching for are useful to them and some of them are non-useful, children will actually give the useful thing. And,
There's, by the way, I just want to interject here and say that one of the best papers, I think, in this whole line of research is with you and Hepach, and I think maybe Tomasello was also there, on how, because just a little bit of a background actually before I introduce the study for listeners is that because one of the obvious kind of criticisms would be that, well, yeah, but this is a kind of I scratch your back, you scratch my back. It's not about sympathy, empathy. It's about reciprocity. It's this idea that we help in order for someone to help us, for you to help me back. And this study that, I mean, I would be much worse at paraphrasing it than you, so please correct me now in every detail I get wrong. But there was this wonderful study you run where young infants, I think they were maybe 2-year-old or younger, saw someone being helped, and you could, by looking at, there was the pupil dilation. So how their pupils react, you can see how they get upset when they see somebody in need of help, and then they get relieved when somebody else helps them. So it suggests that it's not just this I scratch your back, you scratch my back motivation, but it is that you are in harm's way, I want you to be helped. And it doesn't matter who helps as long as somebody helps. At least there is that inclination present.
there is that inclination. Yeah. So the question there was, when children help, because Warnikin and Tomasello and others have shown that they do help. The question is, when they help, is it to get some kind of credit for helping? So it could be because I want you to help me back, or I want others who are watching me to think I'm a good person and then to help me back, and so on. And so what we did, this is Robert Hapuff was the first author, and Mike Tomasello and I did a study exactly where we measured pupil dilation using an eye tracker, where you can also measure how dilated the pupils are, and that sort of taps into how internally aroused you are by a situation. So kind of how impacted you are or how invested you are in a situation. And so what we showed 2-year-olds is someone needing help, and then we either allowed children to provide that help, as prior studies have done, or we held children back and let someone else provide that help, or no one provided help. So those were the 3 conditions. And then we tracked how dilated children's pupils were. And what we found is that in the case where they provided help, their pupil dilation subsided back to baseline levels, because we had a baseline measure, suggesting that they were satisfied, they provided help. Critically, though, in the case when someone else provided help, their pupils also subsided, the dilation also subsided back to baseline levels. So they were satisfied when someone else provided help as well. And in contrast, when no one provided help, the pupil dilation remained high, suggesting that this motivation that they had, or this investment that they had in this situation, had not yet been satisfied, right? Satisfied both if they could help, but equally when someone else could help. And the idea being is, it's not I want to help because I want you to think I'm a good person or I want you to help me in return, but rather I just want to see you help. And I agree that is really nice evidence that it's something about me just being invested in your welfare rather than having these other selfish or self-focused needs, right? And similarly, or sort of relatedly, we had the study that I was mentioning with The child could hand a useful object or a useless object. And if it's just about completing some physical triangle, right? This object should go into this hand, then they could hand any object over, but actually they handed the useful objects over. And we also tracked their pupil dilation in that case. And again, they were satisfied when they saw the useful object going into the hand, but not when they saw the useless object.
Okay, great. Great, great.
So yeah, so we've shown this in a couple of different ways and really tried to rule out these alternative explanations. So yeah.
It's great science. What would be some non-laboratory examples of this? Do young infants, if they interact with other infants, or how do they normally react if someone else is in distress? I mean, I know that there's these studies of like very young infants, I think even newborns, if they hear another infants cry, they can start crying themselves, and it's a kind of example of early empathy, but it's not really necessarily. I think the classic theory was that this is not really empathetic concern. This is just the infant doesn't even realize it's
That's
not
right. Yeah.
themselves who's
And so that
crying. So
theory, that theory is actually currently, I think, in flux in really interesting ways. And part of that is this paper I referred to by Davidoff, where even within 6, 7, 8 months, infants are showing this kind of concern that previously was believed to emerge only later. So that's right. So I think the very earliest evidence is that if infants hear other infants crying, newborns even just a few hours after birth, they start crying. And so that's right. So the idea was that the brain is prepared to respond to cues, social cues of things like distress. But because the infant is not yet cognitively able to think of themselves as separate from others, this is not really full-fledged concern so much as contagion, right? Catching the other's emotion. Um,
yeah, yeah. And because some psychologists have made a really big deal about the distinction even later in life. Paul Bloom had that book called Against Empathy recently, which really wasn't against what people mostly think about as empathy, because it was making the point what he used the terms kind of meaning that empathy is when we get sad when somebody else is sad, and compassion is when we want to help someone who is sad, and that we should be trained compassion rather than empathy. I think it was it was quite a provocative title, I think, maybe unnecessarily so, but I guess it's interesting to notice that distinction is first of all important. Secondly, we can study that even in infancy, and we definitely know that there is that kind of empathetic mirroring, that one is sad, so I'm sad. But then the question is, well, at what point is there this kind of compassionate care?
Right.
That person is sad, I want to help them.
This is the key point. So Martin Hoffman is one of the main proponents of this idea, and he was writing back in the 70s and 80s that what comes early with the newborn contagion, that's really just matching. That's just the brain getting distressed at the distress sound and matching that, but there's nothing about concern, right? There's no other orientedness to it. And then there's various sort of substages, but by the time the infant reaches about 14 to 18 months, the infant is now beginning to do this kind of self-other discrimination. And that's tested in things like the mirror self-recognition task, which is where you place a child, or actually this has been done with other animals as well, in front of a mirror, right? And then you place a red mark on the child's face, and then you look at whether the child recognizes themselves in the mirror and recognizes that there's something on their cheek or whatever, and then rubs it off. Um, Point is that there's evidence that actually infants are differentiating between self and other in much more implicit ways, even much earlier. So, for instance, even very early on, I think within the first couple of months, there's evidence that infants respond differently to their own cry if they hear their own cry versus another infant's cry. So it's not just any crying, right? They can actually distinguish between their own cry and others' cries, and they respond differently. They respond to self-touch differently from touch by someone else. And so, right, and they recognize their own actions versus others' actions. And so there are really implicit ways. They're not past this really conscious mirror self-recognition test, but they are showing implicit ways in which they're distinguishing between self and other.
And so that gives the possibility for there to be genuine concern even earlier than Hoffman suggests.
Exactly. That's exactly.
Okay, yeah.
That's what these findings recently have been showing, actually, is that if you allow for that, and then that will lead you to look earlier for concern. And in fact, there's no big jump from 6 months to 12 months in the amount of concern. The jump seems to be more, I mean, there's a little bit increase, but there isn't any qualitative difference between what a 6-month-old is doing and a 12-month-old, or a 12-month-old and an 18-month-old are doing. It's more in the actions that they can take
Yeah,
in order
yeah,
to
yeah.
respond,
Which harks back
right?
at the earlier distinction between pointing and reaching.
Exactly. Exactly. Yeah. And I find that pretty compelling evidence that there is an other orientedness that's present from very early on, perhaps not right at birth, but earlier than we have previously believed.
And so back to the question that launched this excursion. How do 6 months olds, how do they react if their pal cries by them typically? I mean, do they try to go away from the distressful sound? Do they go to console? Do they do nothing because they can't do nothing? I mean,
So
what's the
6-month-olds aren't yet really moving, right? 6-month-olds aren't doing a lot of moving on their own. That's part of the issue. So they can just watch, they can
Hmm,
look.
hmm,
And sometimes, so the other term that's important here is personal distress. That's a lot
hmm,
of what was originally believed to be happening.
yeah,
What so when essentially when you see someone else in pain or distress, or you see them in pain or distress, that you might empathize, so you might have a similar response. And when that gets too arousing or too distressing, you can experience, rather than empathy, and certainly rather than concern, you can actually experience personal distress, where you find it so distressing that you need to turn away.
yeah, yeah,
And for an
yeah,
infant, that can be crying because they can't really do much to leave or to escape.
yeah,
And Batson, of course, talks about this extensively. He's done these beautiful studies of, when you give the people the choice of staying in the room and helping versus an easy escape.
yeah,
Do they escape or do they
yeah,
stay? And he
yeah.
finds that adults actually do stay.
Well, and they stay especially if they have been primed to feel concern for the others. And I think that's important in a way that if people are asked to take a very cold position towards the story they hear, they behave exactly like the kind of egoistic empathy would suggest, which is they rather walk
That's
away.
right. They'll escape. That's a good point. Yes, that's important to say. So, in the conditions under which they ought to be feeling concern, then a lot of the time they will stay rather than escape, even though
Yeah.
escape is fairly
Yeah,
easy and
yeah.
they could
And I think this is,
do it.
by the way, for listeners, so this this is all work we're discussing is by Daniel Batson, who has a really, really fantastic book called Empathy. Sorry, Altruism in Humans, where he talks about this kind of empathy altruism hypothesis. And we don't need to get to the weeds of that, but if somebody wants to have a book which really, I think, demonstrates experimental psychology at its best, trying to address some really deeply philosophical issues with very, very like a lot of rigor, that's a place to start, in my opinion. So that's a
Yeah,
book
yeah, for
recommendation.
sure.
But yeah, so okay, 6 months old. I take your point. I actually just this summer I had a chance for the first time in my life. Actually, I had two friends who had both had children during the winter. So I was
Yeah,
playing with friends, kids who were 6 months old for the first time really in my life. I'm 30
yeah,
now, so that now is the time that it's starting to occur
yeah.
a lot. And I take your point. Yeah, they can't really do much yet, but perhaps you want to finish the point about what do they then do?
Well,
Yeah,
that's it, exactly. So they will attend, and what they do is that they facially can show concern. And so they are very attentive. They're not turning away. They're not crying themselves very often. Sometimes they do, of course, but a lot of the times they're really intently attending to the person who is in distress. And they show what we consider sort of classic signs of concern: furrowed brow, and kind of that, this kind of downturned lip and kind of big eyes, kind of really showing expressions of concern towards this individual, even if they can't do much. And then, but like within by 9 to 12 months, they can start to point. They might start to crawl over. 12 months, they can walk over perhaps and place their hand on the individual. Now, it's important to say, if the person who's in distress is a stranger, like an experimenter in a lab, they're perhaps less likely to do that than if it's their mother. So experiments have been done where the mother pretends to be in distress, is acting as though she's in distress, versus an experimenter. And there are some differences where infants are, of course, as you might expect, much more willing to go to a familiar individual, to their caregiver, and perhaps a sibling. But they're also willing to do it to some extent towards an experimenter, and even towards, you were asking about peers. There have been experiments where they'll have like a baby doll, and the infant, of course, doesn't know it's a baby doll, or the toddler. And a baby doll is placed kind of high up, and the infant can't see it. But then there's crying sound that's played, and toddlers will actually go to kind of check on the baby doll as well, or to look for the mother, the caregiver of the baby doll, and so on. And so with age, what really seems to be emerging is, first of all, the ability to do something, to move, to speak, to actually know, and then to know how to respond to different situations, because different situations require different kinds of responses. And so the sophistication and flexibility of our responses changes with age. But it seems to be that the core for concern for others and the core other orientedness is possibly, seems to, at the moment, we think, be there very early. That's not to say that that's all there is. Certainly infants are looking out for themselves. Certainly toddlers and older, they're looking out for themselves too. But this other piece is that there
Yeah.
is seems to be there for sure.
And it
Yeah.
seems to be so, I mean, I don't even know how I would start to formulate a criticism that would say, oh, it's all social conditioning, because I don't even know how would you socially condition someone in the first 6 months to do this. But is there what would be the is there a counter argument that this is it, because we're not saying you're not saying it's innate, you're saying that it is, we have strong inclinations in development. It doesn't need to be there, in the same way as puberty is not innate, but we have a strong
Exactly.
inclination.
Exactly. Well, right, exactly. So I think the arguments that are made, and I think they're actually absolutely valid arguments, because as you say, the point is not that these things are, that this is something that's just going to emerge like the color of your eyes, like that's just innate and that's going to be what it is, no matter, the situation matters. And so this is a fairly new area of work, but to the extent that we can understand these things so far in terms of the context, the kind of care that the infant has received is most likely going to be predictive of how caring, the infant then is, and the ways in which the infant learns to respond to others. So an infant that is, well loved and well cared for, and someone responds sensitively to their needs and immediately to their needs and shows concern towards them, at 6 months, there may not be as much variability. That might depend on more other biological factors like temperament, right? So, like, how likely is the infant? How shy is the infant? How social is the infant? How fearful is the infant, for instance? All of those things really matter too. But certainly over the first year, or a little bit more than a year, the infant is picking up on how much have I been, how do people respond to me and how do people respond to others, right, when they're distressed. And that is going to foster or perhaps reduce the likelihood that the infant will respond in those ways. So, what we do in response to others' distress is almost certainly going to be impacted by our own experiences. And this is true of individual family context, but it's also going to be true of cultural context, right? An infant is going to pick up on, if in a culture crying infants are generally ignored, which is not typical. But if there were a culture in which that happened, or crying distressed people were not really attended to, you look away, for instance, then infants might well begin to do that, right? So you're going to pick up on what other people are doing and how other people are responding. So I think that's a fair, I don't think it's a counterpoint. I think it's an addendum to this, that the motivation is present, but what we do with that motivation is going to be variable.
And what should we do? And I think this is really interesting, not only because, well, it's a practical question, so it has practical benefits if we get this question right, but is one of the most famous, and I think one of the most beautiful studies in this whole realm is by Felix Warneken and Mike Tomasello, about how in early childhood, the when they rewarded infants with like toys or candy or something from helping, that was not a way to create long-term helpers. Immediately when you take the candy away, they almost stop. I mean, the helping goes down dramatically, whereas it's not doing anything makes them continue doing so.
That's
So there
right.
seems to be this intrinsic motivation. So it's not
Yeah.
about, oh, I get praise and candies whenever I help, therefore I'm going to help
Yeah.
more. Um, and I think if we just try to understand this phenomenon, oh, that's a beautiful finding. Okay, there's something intrinsic. But that makes the parenting question more difficult.
Yeah. I do want to add something to that, because subsequently, just to complete
Yeah.
that study, I fully agree. I think that study is an amazing, lovely demonstration of this, the intrinsic motivation. And Robert Hebach and others have done subsequent studies to sort of support that argument in really novel ways as well. However, there is some subsequent work by Auden Dahl and colleagues showing that's DAHL. And he's done that with Celia Brownell and others, So they have a couple of really nice studies showing that actually earlier than Felix Warneken and Mike Tomasello had looked, because their study was with 20-month-olds, if I'm remembering correctly, with the rewards, right? But they looked at 13 to 18-month-old infants.
Hmm.
And what they did very similar helping tasks, like the Warneken and Tomasello kinds of tasks. And what they had is, this is experimental. They also have some more observational work, but in this experimental work, half of the infants got explicit what they call scaffolding, so encouragement and praise for helping, whereas the other half of the infants did not. And what they found is that at the younger ages, so 13 to 15 months, which is the first half of that age range, infants who got that encouragement and praise for helping, then later when that was removed, were actually more likely to help than infants in the control group who did not get the encouragement and praise.
Did anybody get candies or toys?
They did not get this exactly
Okay.
right. So that's important that they didn't test that. And I don't think they would have predicted that material rewards necessarily would do the same work. But social reward seemed to be important. And I don't think this is actually a counter. I mean, I think they do perceive this as something of a counterpoint, which is because the Warneken and Tomasello argument has been, therefore, it's clearly intrinsic and it's not shaped at all by what's happening in the environment.
Like by social conditioning.
Exactly, by social input at all. At least that's the extreme
Yeah.
interpretation of the argument.
Purely biological. Yeah.
In some sense, purely biological. I'm not sure that Warneken and Tomasello necessarily make that claim either, but that's the sort of extreme interpretation of that.
That's the claim I would make as the popularizer.
Yeah, right. And so what they find is that by the older age, though by 15 to 18 months, there was no effect of the encouragement and praise. So by that, even just within a few months, it had become internalized enough, or the intrinsic motivation was strong enough, or whatever. It's not clear why there was no effect. But at those first few months when helping is first emerging, this is how they interpret it. It is in fact fostered and shaped. My view on that is it's not that infants are helping to get the praise, but that the praise shapes it, consolidates it.
It's like a seed is not growing because of all the nurturing things that a gardener might do for it, but it does flourish if
Right. A seed might grow, but then what it then ends up looking like and kind of what shape it takes and how, exactly. All of that is impacted, at least to some extent, by the kinds of input it's receiving. And this seems to be the case here too. I think that's great because I think what that tells us is there's a motivation early on. There's certainly an other orientedness and a social orientedness. There's an investment in the other's welfare, but the actions that we take in response to that motivation or as a result of that motivation are shaped, and we can actually foster this behavior through input. I think that's great because I think you have a little bit of both things there then.
Yeah. Okay. So taking this view that there is a something of an innate seed for sympathy, for concern for others, and we can, as society, as parents, we can somehow foster that seed. The way to foster it does not seem to be giving candy, because then the motivation is kind of tilted away from the others towards the candy. The candy is away, helping stops kind of.
Yeah.
It could be social reinforcement. Oh, that was a great thing that you did there, etc. What? And you said earlier, like showing example of not neglecting others' distress. So would those be the two key?
Yeah, exactly. We model, right. I think a reasonable hypothesis would be that there's lots of sources of social input. And I think direct responding to the infant's own behavior is one, but not only do we not do that all the time, in lots of cultures that actually happens fairly rarely, that people respond directly, are sort of providing direct feedback constantly to an infant in the way that we do in Western middle class homes, right? In lots of other contexts, there's a lot of observational learning. And we know that in those contexts, infants and children are better at learning from observation. And so in those contexts, even if the infant isn't receiving direct input, they are watching. How do we respond when others are distressed? What kinds of behaviors do we engage in? How do we help them? Do we tell them to get over it, which perhaps in that cultural context makes sense? Or do we actually really kind of go up to them and console them and make sure their needs are met, which may make sense in other contexts? And so they're learning the socially and culturally appropriate ways to respond to others' distress. but I think that the fundamental motivation to care about others is likely what's being fostered there and being used in productive ways. Yeah.
Is there anything else than those two things? So showing and praising.
Yeah. So this is not quite about just these really basic pro-social behaviors, but in the context of guilt, for instance, and conscience, Martin Hoffman and subsequently others have also argued for something called inductive parenting. So there, the idea is the way to help children make better decisions and behave more morally and pro-socially, and in particular to do the right things, to make amends, for instance, and to regulate their own behavior in ways that don't hurt others and that do help others, is to help children take the other's perspective, to imagine what the other feels like, or to think about what the other may have felt like when they hit them or took something away. Because his argument is when we do that, then children's natural disposition towards empathy or tendency for empathy will take over. As soon as we, rather than thinking, I wanted that thing and I'm going to take it, if we help children say, but, you've had a turn, maybe the other, he's been waiting or whatever it might be. Or when you pulled her hair, how do you think she felt? When we do that, what we're doing is we are sort of tapping into the natural empathy that is present that isn't always put to use. And so this is what he calls inductive parenting, and there is evidence, in fact, that doing that helps children both make better decisions in terms of how to interact with others, but also make amends after they've hurt someone, because they can reflect on how did my actions affect the other. And so there are much more active things parents or caregivers can do as well.
Well, what about punishments? So I think that there's an obvious way, and there's good evidence for this, that the kind of very authoritative punishing style will not be conducive, even without evidence. I think it just makes plain sense that if you tilt the child's consciousness towards self-preservation, then you're not real tilting their behavior towards that other that they hurt. And so there is an obvious way in which just using a whip won't do the job. But I also don't want to pretend, I don't want to be as naive as to say that you can do the whole raising children with only carrots and no sticks ever, or just
Yeah.
carrots and natural goodness
Right.
combined. So where in your opinion, or where does the research point to at in terms of like when and how do sticks come
Yeah, no, I think that's a really good question, and I do agree with you that, and certainly on my own experience, it's the case that
in?
it's not all roses and sweet things
Yeah.
and right. I mean, there are absolutely moments where more some sort of disciplining is required, and the question, of course, is what should that look like? It's a very complex question. This is actually again a place where I'll refer to Maya Davidoff, who has published on what they call domains of parenting. So this is Grusek and Davidoff. They've written about this in various different contexts. And the idea there is that children and parents interact in lots of different domains. And so there isn't any one kind of parenting that's required across all the domains, so that in fact, in different domains, we need to do different things. So in some domains, when a child is feeling distressed and threatened or upset about something and scared about something, our job as parents or caregivers is to alleviate that distress. And so we are caregivers. It's the comforting kind of domain. A different domain is one of reciprocity. When we're playing with the child, we're equals. We can treat each other as equals. We allow for the child's requests. The child allows for our requests. And this is a really important way in which um, children learn to cooperate with others, to work with others as equals. So that's another domain. And in that domain, comforting is not the appropriate response. It's this kind of mutualistic, equal kind of respect, right? And then there's another domain of control where it's equally important as caregivers that we show our children and teach our children to obey and to accept the rules of our culture, of society. And this is the control domain often comes up in misbehavior or in acting in socially inappropriate ways, whatever that may look like. And in that domain, comforting is not appropriate and reciprocity is not appropriate. We need to do some kind of disciplining in order to teach the child that was inappropriate or these are the appropriate things to do here and so on. And in those places, we do need to rely on some disciplining strategies. And what they talk about are things like we have control over resources. We control whatever, the resources in the home, television or food or whatever it might be. And there are effective ways that we can do that without physical punishment, although in some contexts that is also used. I mean, the evidence is pretty clear that things like spanking are not only not helpful, but are harmful to children's long-term development. And so that is absolutely should not happen. But non-physical disciplining strategies like control of resources in order to make children essentially, quote unquote, fall in line, because it is important for them under certain contexts to behave in socially appropriate ways if we want them to be productive and sort of good members of society. And what's important, and they stress this as well, and I think this is a really important point, the kind of discipline needs to be appropriate both for the type of misbehavior, for the age of the child. The expectations that we have on the child need to be appropriate, right? And all of that is important. Those are caveats that really need to be in there. But the larger point is that certainly a place for discipline as well. I think that the fundamental point is that there just is this competing demand of egoism. There just is a selfishness that we all have in us. And sometimes, especially at younger ages, when we are not yet able to regulate and negotiate between these parts of us, that's the part that wins out. It's too, I wanted that thing too much and I couldn't do all the things that I've been told to do, and I just needed to go get it, right? Even as adults, we have a hard time inhibiting that sometimes. And so that teaching to regulate, to suppress sometimes at some critical moments, our own desires, for the greater good or for the sake of others is something that we need to learn to do as well.
So in a way, I guess is one way to think about it, that there are a lot of cases, many more than people like our bashing on Freud all the time. But it's not just Freud. I actually just in the last episode of the previous season, I mentioned that one of the most quoted lines really in the history of popular science is Richard Dawkins' line that we should teach altruism and generosity because we are born selfish. Now, interesting anecdote is also that Richard Dawkins later said that this is a rogue claim that readers should mentally delete. So
Is that right?
that is right. That is right. You go to the 30th anniversary edition of The Selfish Gene, and that's what he says.
Very interesting. That is good to know. I was not aware of that.
Yes, that's the argument that much more people are aware of the second point. But yeah, so it's not. I mean, we can call it the Freud-Dawkins thesis, which is that we're born selfish. No, sometimes people just genuinely what they want is they want to help that other person. But then the question is, well, that's not all the time. Sometimes we want the things to ourselves, and is that kind of where disciplining and more that kind of parenting comes in? Is that where we cannot only rely on fostering? Although I guess is what you're saying still that it is always optimal if we can do it via fostering those pro-social tendencies. Like, was that kind of what you suggest as Hoffman's point would be, that this kind of inductive parenting is that whenever we can do it via that fostering way, that's great, but sometimes we cannot, and then we have to discipline.
That's right, exactly. I mean, I don't know if Hoffman explicitly addresses it in this way as like it's either this or this and this is better. But yes, I mean, essentially the idea is that when a child has just hit another child, that is a moment rather than, for instance, disciplining. A one way to not only make the child do the appropriate thing in the moment, but actually for the longer term internalization of these norms and for the development of a conscience, which is a really important part of being a good cooperative member of society, is not, don't do that again and I'm gonna, go to timeout necessarily, but rather let's think about how the other person felt, help them take the other's perspective, because his argument is that's going to tap into these natural tendencies that we all have, and including young children have, for empathy and for concern for others. And if we do that, we're not only taking care of the behavior in the moment, but at least over long term, it's not something that's going to happen right away, but long term, the use of that kind of strategy has a much higher chance of resulting in a solid, kind of robust conscience that helps us navigate these situations much more optimally. Yeah.
I also do want to ask about those people who don't fit into I mean, most of the studies that you and other people in this line of research do are kind of groups. And I remember your colleague, Robert Kipach. I remember hearing him say that when you're studying, for example, 6-month-olds, I mean, the whether they had a good nap or a bad nap before, it is such a big variable that you never really learn about the individual. But what you do get is you get this group average, and it certainly says something interesting about some general tendencies in most of humans. But what about those who don't who don't fit into that average human category? So I'm thinking about, for example, in kind of discussion around neurodiversity, one of the really tricky issues is how to understand the relationship between empathy, compassion, sympathy, and autism. And I have personally struggled with this because I hear often autism used as an example where these kinds of early pro-sociality, sympathy, empathy might be lacking, but then having, for example, read books written by and knowing people, even pretty deep on the autism spectrum, we can be very compassionate, empathetic, sympathetic people. And so I never trust anyone who says that, well, autism equals lack of empathy, because I'm like, no, come and meet my mate, you know. But on the other hand, there is that kind of point about developmentally, at least, even one of the hallmarks of autism seems to be some deviation from the statistical norm in these kinds of things. Yeah, I don't really have a question except that I'm puzzled, and I think many other people are puzzled.
Yeah.
So do you have any light to shine or?
I mean, the first thing I'll say is that it's not my area of study, autism specifically. I myself have not worked on this. I've read about it to some extent. And I have a colleague here at my university, Vikram Jaswal, who is studying these kinds of questions more deeply, not necessarily about, empathy and so on, specifically in autism, but really very much around the point that you're raising, which is that there is this belief and there's this kind of push in the literature, has been for a while now, that theory of mind and perspective taking, and therefore the ability to empathize and so on, are reduced, if not absent, in autistic individuals. My understanding, again, this is not my specific area of work, but my understanding is that the evidence isn't even so clear that, for instance, autistic individuals fail theory of mind tasks just universally. That's just not true. Even in the very original Baron Cohen false belief work, where he examined autistic children's versus typically developing children's ability to pass the classic false belief task, where, do you understand that someone has a belief that is not true of the world, or that two people have different beliefs, right? And the conclusion from that was that autistic people, the autistic individuals, failed. But actually, if you look at the numbers, some actually did pass, and not all typically developing children did pass. And so there's a lot of variability. It's a spectrum. And then, of course, we have to ask about, are these the right kinds of tests? And so if you change the kind of test that you use, if you add a motivation, for instance, to the task, like there's a reason why you should get the answer right, rather than that it's just a test question and I'm just asking you, and do you know? If there's a reason you ought to get it right, there's a motivation for getting it right, then autistic children do better. So there's a lot of complexity here. And this is just about theory of mind, but I imagine it applies to empathy as well. And more generally, I think when we look at autistic people's self-reports, if we actually ask them, how motivated are you to be with others, because there's also this general sort of understanding of autistic people as not wanting to socialize, as wanting to be left alone. And that just doesn't seem to play out either. That doesn't seem to pan out.
So it might be more about, at least it's not so much about motivations as much as maybe sometimes not understanding some cues as well, or whatever. But
not understanding some cues there's actually, you might find this interesting. Again, it's not my area, but I've been hearing about this because some of this work is happening in my department, the talk of the double empathy problem. So it's not just that the autistic person doesn't understand the typically developing person, but also the typically developing person doesn't understand the autistic person. So it's a double empathy. We both aren't able to fully comprehend what's happened to their individual.
Yes, that makes a lot of sense.
And can read the other person's cues as well. And so why do we focus on the fact that the autistic individual isn't responding, quote unquote, appropriately? Why aren't we talking about the fact that the typically developing individual isn't responding appropriately?
That makes so much sense when you put it that way.
Yeah. And so I think there's a lot of really new and interesting discussion going on around these topics, which I think relatively soon may really change the ways in which we perceive and think about what's really going on with autism. And I agree with you. There's really been this belief that empathy is something that's really missing there, although even there, it's been about affective empathy versus cognitive empathy. So affective empathy seems to be, I believe, quite similar in autistic individuals. It's more like cognitive empathy.
Yeah, so I think affective empathy being what we've been talking about this whole time. So
Exactly. Feeling with others, feeling for others, versus being able to understand what the other person is thinking, like beliefs.
So actually it might just be this cognitive bridge that we have to cross between neurotypical and atypical people, is to understand each other. But that's really nice to hear. Well, that's a very bright note. Let me bring a a darker theme. Is anybody born a psychopath?
I don't know. So also not at all my area of work. I imagine that just given neurodiversity in general, that some brains are have more challenging time thinking about others, bringing others to mind, or keeping others in mind. I can totally imagine that that's harder for some brains than others to do. And so just innately that there's like fundamentally that's how biology functions. We have variability. And so there are people who are, there's also extreme altruists, right? So who can't help themselves. They have to do everything they can for others, and that is debilitating as well. It can be extreme empathy can be debilitating. John DeCidi has and others have done work on this, right? Of showing that doctors who feel too much empathy have a hard time functioning, and you have to actually cut off your empathy when you're cutting someone open, because if you feel too much of what the person might be feeling, then you can't really function, right?
Well, hold on. Isn't there a distinction just between what we discussed earlier, between empathetic kind of matching, mirroring versus sympathy? I mean, you can feel sympathy for the victim and not feel.
Yes, that's right.
So is there any evidence that it would be bad to feel a lot of sympathy for your patients as a doctor? That might be, but is there any evidence for that, or is it just about this matching?
I don't think the literature has done that, made that distinction. It's more about
okay, but they should.
They should, yeah. I think they should. That's right. I mean, Jean DeCidi primarily focuses on this kind of mirroring, and finds that if we do too much of it, that's actually can be debilitating and it's exhausting.
And that makes sense. I mean, as a parent, you don't want to be sad and stressed every time your child is sad and stressed. So
that's exactly right. What I was saying was that there just is this variability in the ways that our brains work, and so I completely believe that some brains and therefore some individuals will have more of an empathic impulse or less of an empathic impulse, or more of a tendency to think of others versus less of a tendency to think of others. I think that that's very likely. And that's going to depend on all kinds of things. That's going to depend on genes and temperament and so on. But for something to become psychopathy, which is something that's diagnosed in adulthood, obviously. I mean, we can have conduct disorder in some childhood, sort of things that look like
callous and unemotional.
Callous. That's actually what it is, not conduct disorder. That's right. Callous kinds of behaviors. Certainly, that can have deep biological roots for various reasons. But for something to really become psychopathy, I really believe that there's going to be social influences there as well. Just as our selfless impulses, our pro-social impulses are fostered. I think our egoistic impulses and selfish impulses can also be fostered in some environments. And we know that things, traumatic events or very, very challenging events in one's life can also put us on these kinds of paths. And so I think the reason I hesitated when you asked me about psychopathy is this is just my personal view. This is not my area of study, but my understanding from the little I know of this literature is none of this happens in a vacuum. That nothing is inevitable, in any of this, right? And so there are going to be seeds of some things, and some of us might have a greater tendency in one direction or another. But the ways in which that plays out, and the kinds of support that we need, that we get or don't get, and the kinds of emotional feedback that we get throughout our lives is going to have a really important role to play. And the kinds of general treatment that we get and we see others getting, all of that is going to play an important role. And so psychopathy as like someone is just sick in the head and needs to be put away is, I think, a problematic concept, because inevitably there's going to be these other influences.
Yeah, for me, one of the most important counterpoints to that kind of, well, psychopath period, lock them away, is Scott Barry Kaufman in his, I think it was in his book Transcend, he mentioned that the scales of psychopathy fluctuates quite a lot within individuals throughout their life.
Ah, right. Yeah.
So it's not a locked in value that you just have and you carry like you carry your, the color of your eyes.
Exactly.
Yeah, I haven't seen the data on it. I just remember him mentioning this, maybe in a podcast, maybe in the book.
Yeah.
So yeah, please don't quote me quite on that, but I'm not making it up completely either.
Don't quote me in any of this either. A lot of this, certainly in the psychopathy world, is anything I speak on that is just my very peripheral understanding of this literature.
Well, that's why I'm sorry to put you on the spot. I'll keep you there. We'll get back to your specialties soon. I want to talk a little bit about guilt, but before we do, one question, which I guess is also a little bit of a, I don't know if you have any direct experimental evidence about this, but what do you think of sadistic antisocial inclinations? So we've talked so far about pro-social versus selfish inclinations, and unfortunately, I think we all know that, for example, harming animals from curiosity, etc., is not it's not just something that you find in 1% of the population who are psychopaths. Period. It does happen. I don't know if it happens with everyone, but these kinds of inclinations to actively harm. What do you think about them? Where do they come from? To put it in a theological term, Augustine says that there is no evil, there's just absence of good. Versus the idea that there is. So is this just an absence of empathy, or is there another kind of satanic impulse?
Which is, I actually want to hurt you.
Yes. And so sometimes, of course, it comes from anger and desire to punish it, revenge, whatever. But when it's, you just want to cut a cat's tail off, or you want just, where does it come from? How common is it? Where does it come from? Do you have anything?
I don't know. No, I don't have answers to that. I again, my tendency personally is to go to what are the social experiences that you're having that are leading you to want to hurt, and what are you expecting to get out of it, right? So are you expecting attention, for example? Is that what you need, in fact? And is this your cry for help in some way, right? I don't know.
Yeah. My naive theory is that it's quite often a matter of lack of sympathy combined with curiosity.
Yeah, that's I think that sounds right. But what is the lack of sympathy about?
Yes. I mean, that's of course the question. But I have an anecdote about this actually. When I was doing my my master's, I read quite a lot about modern Chinese history, and one of my favorite books was this really remarkable book. It's remarkable that it exists, which is that the last emperor of China, Puyi, who people might know from Bertolucci's amazing film Last Emperor, he actually wrote memoirs. And so he was the child emperor of the Manchu dynasty when it came down, and then he was, as the movie tells you, he was allowed to stay in the Forbidden City for quite a few years, and then he had to escape, and then he became a puppet emperor of Japan. And it's a great book to have. Like, it's incredible that kind of first-hand account exists. So anybody who wants to read some fun history memoirs, there's a recommendation. But the point is, there is a moment in his childhood he recalls when he wanted to give a kind of cake for one of the eunuch servants with pebbles in it. And he did it. And he put pebbles in, and he had this cake ready. And what happened was that his mother was not really the caretaker. It was one of the wet nurses that was the caregiver. And somehow she realized it, I think. And then what Puyi recalls is that when he was asked, why did you do it? He said that I really, really wanted to see what it would look like when his teeth break.
Oh gosh. Yeah.
And that's the curiosity. And then what happened was that the wet nurse was able to make him think about what it would have felt like. And he was like, okay, bad idea.
Yeah.
And so for me, that I just remember that as a kind of like this I mean, why no sympathy? Well, in there it's kind of obvious. It's this very weird power dynamic where you basically is a slave owner as a child.
Yeah.
And
Yes.
and so there's this lack of sympathy, but it can still be kind of remedied with that Hoffmanian inductive parenting. And there is curiosity.
Yeah, that is really interesting. And as I'm thinking about this, I mean, to some extent, some form of dehumanization.
Yeah.
Because you talk about the power dynamic, and when we talk about hurting animals, for instance, it's easier to see how there is perhaps like Paul Bloom talk about this, right? Or in general, there is in the literature your circle of empathy, right?
Yeah.
Or whatever.
The circle of compassion. Yeah, I think that comes from Peter Singer originally. Yeah.
Peter Singer, that's right,
Yeah,
exactly,
yeah.
right, exactly. So, like, what is your circle of compassion, right? So, are you extending it to just your family, to just your extended family, to people who look like you, and then all of humanity? But then, does it also extend to animals? Does it also extend to plants, right? And so, I think there's some degree of that as well, where if you are able to distance yourself psychologically or dehumanize in some way or see as less than the individual that you are hurting, then you don't. Then you can also. I mean, that is actually a way probably to regulate if you're over empathizing. It's actually a way to say, oh, I have to just distance myself, right? In fact, this is in some sense what people who have to reduce their empathy like doctors might need to do. You have to view it as not a person in that moment so that you can do what you need to do.
Yeah, it's a corpse, living corpse.
Something or something, right, exactly. And so
or probably the Latin names help. You're just seeing a lot of Latin names hovering above the muscles and the
yes.
arteries.
Yeah, exactly, right. Right. And actually we have some work with children that came out recently. We found it in fairly young children, in preschool age children, where if you give children the chance to help someone, all we did is, does that person that you're helping have a name? Do we give it a name? You can help Mary. You can share some stickers with Mary, or you can share the stickers with another child. And that's it. And we found that children are more likely to help someone that has a name than someone who doesn't have a name. And you can do that with other ways of identifying the victim as well. And this is a well-established phenomenon among adults. And it looks like children are also, at least by about 3 to 4 years of age, sensitive to that. And we didn't test for the mechanism, but our hunch is it's something to do with as soon as you imagine a person with a name, the name already elicits more personhood in some sense, right? More of a with than someone that you're more distant from and have no other information about. And if there's a photograph, that would probably increase your connection with that person more. And if there's some additional information about their situation, perhaps more. And so the closer they are to you, the more compassion you could feel towards them.
So would it be, I mean, taking the morality completely out of the picture, would it be better to pulling legs from faceless insect is less of a sign of possible psychopathy than cutting the tail of your pet cat who has a name? And that the former is more an expression of this kind of just so distant that I'm not sympathizing, versus doing it with a pet cat, it's kind of like there seems to be something.
Seems to be closer. Yeah, exactly. Right. If the closer this individual or animal or whoever is to you, and the more you're able to do it, the more worrisome I guess it would be. I'm not sure. I don't know what the empirical work suggests on this, but that would be my.
Yeah, well, we are pretty far now, in the speculative territory, so maybe we can read.
Yeah,
sure.
But
thanks for giving your thoughts. These are questions that we're all being puzzled by one day or another, and at least you have a pretty solid empirical basis to make your hunches wrong. So
I mean, yeah, certainly hypotheses. I have hypotheses.
yeah. But let's return to the empirical work, because I mean, so far what we talked about is this idea that it's not that we are born selfish, and then we're somehow replacing our innate selfishness with all these societal norms. Like that's not really a very good way to explain what we observe when we observe as carefully as you and your colleagues do. There is some kind of proclivities for unselfish concern. And there the question really is that the earlier we find it, the kind of better. But then there is the question of how these things then starts to be shaped after the first couple of years of life. And am I paraphrasing your line of theorizing correctly in saying that we start pretty general, undifferentiating concern for others, and not completely undifferentiated, but more, and then it becomes kind of, first of all, more tuned to like when is it appropriate to feel, for example, sympathy or not. And then there's also very interesting other pro-social emotions, which we will get, like guilt and gratitude, that are also kind of built on top of this. So at the very origins, there is sympathy, empathy, or some kind of unselfish concern, and then it starts to be a little bit like, then it gets much more messy in an interesting sense. Is that a correct paraphrase?
Yeah, I think that that's probably, I think that that's right. Yeah. I mean, I think at the very start, there is just a deep socialness, right? There's a social orientedness that's just present from the get go. I think that's undeniable. And very soon after that, within a few months, we do begin to see signs of really attending to various kinds of cues, and as we talked about, within 6 to 8 months, apparently, right, the new evidence suggests some concern for others. And then, yeah, within the second year, the ability to act on that concern in various interesting ways. And then, first of all, those behaviors, those prosocial behaviors, become more complex and flexible and sophisticated, but then also potentially differentiating out, yeah, from those early concern and sympathy and ability to think about others, and motivation to think about others. We get to these more complex kinds of emotions. I think that's right, and motivation.
Well, then, really interesting thing about this more complicated later uh, pro-sociality in early childhood is the feeling of guilt, and actually feel with guilt and gratitude together as these kind of things that can allow us to maintain social relationships. Because when things go wrong, guilt is a way to, first of all, prevent things from going wrong, and then want to repair things when they go wrong. And gratitude is a way to kind of maintain positive interactions. So it makes even from a game theoretic point of view, it makes a lot of sense that sometimes you get these kind of unfortunate cooperation failures, and then those are the kind of emotions that we have been given to fix it. And that was really fascinating. I think, first of all, it's a very illuminating way to think about those emotions. But then I also started noticing things about guilt that I hadn't before. So one of the really interesting things about guilt is that there is a sense in which it's quite linked to sympathy, to concern for others. But then there's a way in which it isn't, because one of the hallmarks of sympathy that we discussed earlier was this desire to see the other one helped by whoever. It doesn't matter who helps them, as long as somebody helps them. That's great. And one of the hallmarks of guilt in also studies done by you with, I think, the exact same colleagues, is that when you feel guilt, it isn't just that somebody fixes. I want to be the one who fixes it.
Yes. So this is a relatively new area that we've been exploring, well, for a few years now. And I think you're right that it does that in general we do think of guilt as stemming from basically a concern for others, but then it has this additional piece of, but I caused that harm. So it's not just that you were harmed, but in addition, I was the cause of that. And that changes the balance of, that changes kind of the quality of what it is that I'm feeling. Because it's not just that I am concerned for you, it's that I feel badly about having hurt you in some way, at least at this very basic kind of interpersonal, because we can feel guilt about lots of much more complex things. And we're not talking about that. I think from an evolutionary perspective, the most likely place for the emergence of guilt is these interpersonal interactions. And so that's kind of what we've been focusing on with children as well. And the idea is that, yeah, when you are hurt, I want to help you. And it makes sense for me to want to help you because you are my partner. And the healthier you are and the better off you are, the better we can work together to achieve things. But when I am the one who has hurt you, it's really important not only that things are made right for you, but that I show you in some way I am a really good partner. I am a reliable person. I'm a trustworthy and cooperative person. And that changes the quality of what it is that I'm feeling. Because as you said, it's not just I want you to be helped, but that I want to be the one that does it. It's important to me. So my motivation now is, in that pupil dilation study that we talked about, right? It's not just someone should provide that help, whether it's me or someone else. Now, in the guilt context, when I'm the one that created this distress or need for you, I should be motivated to actually provide that help. And that's exactly what we find when we create an experimental situation in which children are sort of sort of in some way tricked into hurting someone. So they do something, they don't really mean to do it, but we kind of create a situation in which it looks like they are the ones that caused someone harm. Then when they have the chance to make amends versus they are held back and someone else has a chance to make amends, now we find that their pupil dilation only subsides to baseline levels when they are themselves have been able to help rather than someone else has been able to help. And in other work, not using pupil dilation, we've also looked at sort of how guilt manifests and when it begins to manifest. And rather than, and among adults, we can ask them, how guilty do you feel? And can you rate it on a scale of 1 to 5 or whatever? But with young children, we can't really do that. And so we really look at their behaviors and we make predictions about, okay, if what they're feeling is guilt, then this is what we ought to see in this controlled experimental kind of paradigm. And so one example is the pupil dilation study that I just described, where we said, if what children feel is something like guilt, then they should only be satisfied if they are able to help. And that's what we find in the pupil dilation case. In a different study, which was just looking at their behavior, we compared a situation in which they had caused harm to a situation in which someone else had caused harm. So we compared the effects of guilt versus the effect of more general sympathy. And we again found that children were much more likely to try and repair the harm in some way if they had caused it than if someone else had caused it.
The harm here is something like someone's castle being broken.
Exactly. Some kind of picture that they had put together, like with blocks, right? And it sort of stressed how important it was to them and how much time they had spent on it. And now the child did something accidentally, but still they were made to believe that their action had caused this harm or someone else's action had caused the harm, right? And so the more predictions we make in this realm about, well, if it's guilt, then we should see this behavior in that condition, but not in the others. And the more we can sort of support this in different ways, the closer we can get at the conclusion that it really is at least the beginnings, rudimentary forms of guilt, if not full-fledged adult guilt.
One of the things that is fascinating about that is this comes later. At what age do we start seeing guilt?
So the earliest that we've seen it in our behavioral paradigms or experimental paradigms where we really try to look at a guilt-like situation compared to very similar non-guilt situations is about 3 years of age. But people who have done more naturalistic observations, for instance, where they just say, how do children react when they've caused harm? And do they show behaviors that generally look like guilt? So, apologizing, turning away, trying to repair, all of that. Then they find evidence as early as maybe even 2.5. So somewhere between 2 and 3 years of age.
But a little bit later. And I think that's why it's interesting, because there is a kind of a way to think about the origins of morality, for the lack of a better word. It's quite typical. It starts from something like game theory, I scratch your back, I scratch your back. And then it would see these kinds of, oh, my reputation is at harm's way, I have to help you now, like as the kind of origin of this. And then maybe at some point you almost forget that underlying motivation, you become a genuinely sympathetic person. And what it seems to be is that flips, that is actually the inverse image of what really is going on. What we have in the beginning is just this, oh, whoever helps. And then later on in development, we start having also this kind of emotion like guilt, where, no, I want to repair what I have caused, or at least it doesn't seem to come earlier, is what the evidence suggests.
Yeah, that's a really interesting point, actually, to sort of contrast it with the general approach and the game theory kinds of approaches. So it does seem to be that if anything, then early on it's pretty general. Of course, there'll be some preferences in terms of like, I trust my caregiver, and so I'm more likely to approach my caregiver if she's distressed than a stranger, something like that. But it, in very general ways. And I think to your point, there is evidence that other, let's say, less altruistic motives like reputation management are also important for children. But the earliest evidence we have for that is somewhere between around 5 years of age, maybe to some extent 4 years, right? But it is the case certainly by 5 years, and in some implicit ways, even by 3 years of age, I think that they start to monitor that whether they're being watched or not, and change their behavior according to whether they're being observed or not. So they're more helpful. This is people like Jan Engelman, also with Mike Tomasello, and others have done these studies showing that they are more likely to help when someone is watching them than not watching them. They're less likely to steal when someone, like cheat at a game or steal something that they need when someone is watching them than when they're not. But that's not something that they're doing right away. They're not. That's something that just has to emerge later or does emerge later. But they're not really. Their prosocial behavior doesn't seem to be taking those things into account until somewhat later. Yeah.
Fascinating. I'd have a lot more to ask, but I think it's time to start wrapping things up. So before we end, with all the work that you've been doing, especially with children and more generally with human psychology, studying the mind, how has all of that work shaped your view of our species?
So I think it has really helped me understand a lot of what I've already been saying in our discussion, which is just this coexistence of these competing motivations. And I think that that's really important to keep in mind when we try to understand why people behave in ways that they do. To think about, there's a fundamental question that I have had, which is part of why I do the work that I do. And I think lots of people have is, are we basically good or are we basically bad, right? That's just one of these core morality related questions that everyone comes up against at some point. And I think that my work and the work of, my colleagues and others has really helped me see that it's just both, that we're neither one only, that we just are both, and both motivations are present from early on. And I think that that's a hopeful message because it means, against all odds, the fact that we have any goodness in us to begin with is amazing. I think that really is against the selfish gene idea. It is against this idea that it makes no sense for us to ever look out for anyone. It's against the game theoretic idea or the homo economicus idea. And it really is about, I genuinely have come to believe, based on all of this work, that there is a core motivation that's other oriented from the start, but that it coexists with a core motivation that's self-oriented. And that's neither good nor bad. It just is what it is. And we have to make the most of that. And I think the fact that the core motivation for doing good and for other orientedness exists really opens this door to fostering that natural tendency rather than thinking of it as fighting against nature. If we think of others as having the core seeds of goodness present from the start, we can build on that rather than thinking that we have to constantly regulate everyone's actions and go against what comes naturally to them. And I think that that's a really hopeful message. I think that that's a positive view of humanity.
Dr. Amrisha Vaish, thank you very much for your wonderful work and your time today.
Thank you so much. This was really, really fun. Thanks a lot for this great conversation.
So that was the 22nd episode of the On Humans podcast. I hope that you enjoyed it. If you did, then please do consider supporting the podcast by one of the many possible ways. The easiest thing to do is just to share it, rate it, subscribe to it, anything that helps the show get more listeners. If you want to help financially, there are two ways to do it. You can become a monthly donor via patreon.com, or you can just get your free audiobook. There are some links and book recommendations in the episode description. Anyways, I hope that you decide to tune in next time. Until then, take care.